Now, as part of the deal to reopen the government, Republicans agreed to hold a vote next month on a decision to extend health care tax subsidies. So, despite a reopening on the horizon, concerns still loom for many nationwide. And WTOL 11's Jack Crum joins us. You've been looking at how the shutdown has created some questions for people and organizations right here in Northwest Ohio.
Jeff, I reached out to several community-based public service organizations in Toledo today, getting a feel for what they've heard from people. They all say they fielded calls the last 8 weeks about how this could disrupt health care and food assistance for vulnerable residents. It's day 41 of the government shutdown, and there's still uncertainty in Northwest Ohio for health service organizations.
A lot of patients who are a little nervous about just what they're hearing, both rumors and from the news on what's happening with the Affordable Care Act and Obamacare and what it might mean for them and their coverage.
Shane Douglas is the COO of the Neighborhood Health Association. It's a federally qualified health center serving as a so-called safety net for basic health care needs. He says some patients support reform, but others are scared of changes they don't understand.
Some proponents of changing the program, we know that not every program is perfect, especially as it has years to develop and move on. And there's other proponents that are just really scared.
They aren't the only county-based organization getting calls. The Lucas County Board of Developmental Disabilities says it's getting questions focused on uncertainty about SNAP benefits. But there are concerns about what changes to the Affordable Care Act could mean for their low-wage direct support professionals.
The direct care staff that work with them would be affected by that. And we would hate to see something happen that they no longer would be able to stay in the profession of providing direct service.
Justin Moore is the president at the Area Office on Aging of Northwestern Ohio. He says they've heard from concerned citizens about changes to a slew of federal programs, mostly the ones that impact those 60 and over.
Initially, people are just concerned about their benefits in general, or maybe some specific benefits, whether it be Social Security, Medicare, Medicaid, Supplemental Nutrition Assistance Program or SNAP, Home Energy Assistance Program, so on and so forth.
I also reached out to the Toledo Lucas County Public Library to see if they've noticed an influx of calls with questions about health care subsidies. They tell me they haven't noticed an increase, but they say they're willing to help people find support for all their health care related questions. Reporting live in studio, I'm Jack Crum, WTOL 11.